Let's listen to an expert doctor for hypertension in young population along with coronary artery disease or higher heart rate. Can be sure of happy heart?
Hi, this is Dr. Santhani Bishal, consultant diabetologist from Chennai Diabetes Center, Kharagpur.
How do we define hypertension? And when should we conclude that the person has hypertension?
So, actually, this is a very critical question because we stage hypertension in various cases based on age, based on comorbid conditions. That is, what are the complications you are having along with the blood pressure. So, for general, like to know when is a patient called a hypertensive patient is blood pressure more than 120/80. There are many stages, that is stage 1, stage 2 and above. Usually the systolic, that is the upper part of the blood pressure should be less than 130 is what is recommended now. But when you're having comorbid conditions, like when somebody is having a kidney issue, diabetes, and other conditions where hypertension is going to play an important role, there are restrictions, and I think that goes on medically. So we decide accordingly to treat with drugs. For the general public, you should know anything more than 120/80 is hypertension.
Has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
So yes, that is what a very important question here, because earlier days it was considered like middle-aged men more than 40 years and female more than 45 years were diagnosed with hypertension, and they had incidents of heart attacks and other related issues. But nowadays we are having early onset of hypertension even as early as adolescent age group 15 to 20. So that's a very surprising finding which we are seeing in our day-to-day practice. And I think the major reason here could be lifestyle changes and bad food habits and nil physical activity.
What precautions should a patient take along with medications?
So precautions is, see, the drug part, the medicine part is taken care by the physician, the doctor who's prescribing the drugs based on whatever findings they get. But patient side, what they should do is completely take care about their food habits, taking junk foods, taking food on the wrong timings, and taking extra salt, aerated drinks and beverages and alcohol intake, smoking. These are the lifestyle changes which is very, very important, and mainly the BMI, which is playing an important role now because of the high body weight, where obesity is playing a major role in early hypertension. And there is no physical activity at all. There is no special time given for any physical exercises because all of them are busy in their lives and they are stressed so much they do not have good quality of sleep also. So this is very important. So a good quality of life with good physical activity, lifestyle and good food habits is the add-on therapy along with the drugs, such that the dosage of the drug will also be less and the complications because of hypertension will also be less in future.
Thank you, doctor, for your valuable response. Public Awareness Initiative by Glenmark Pharmaceuticals.